recent study suggests at least 5 out of every 6 American adults have some level of immunity right now to COVID-19, either through vaccination or a previous infection. Here to explain is Dr. Daniel Kritzkis, Chief of Infectious Diseases at the Brigham. Dr. Kritzkis, great to see you.
Great to see you, Erica and Ben. Good afternoon.
Good afternoon, Dr. Kritzkis. Kind of hard to believe on one level that it's been nearly 3 years since we first heard the term COVID-19. So how do the strains that are circulating today compared to that one strain that triggered this global pandemic back in late 2019 and early 2020?
It's really hard to compare the strains because they appeared at different points in time. Certainly the most recent strains, the XBB variants are what is circulating now and what are able to escape immunity. Whether they're really more transmissible or more serious than the early strain, we could only guess at that by trying to do experiments in animals, because in the human population, because there's so much immunity, as you discussed, we can't really make those comparisons. We do know in China that XBB and the current Omicron variants are wreaking havoc. And so that's a reason to think they probably are very transmissible and serious in a non-immune population.
Okay, well, so we know you and your colleagues at the Brigham still battling 3 respiratory viruses at least. So we're talking about the flu, RSV, COVID. In terms of hospitalizations, even deaths, is one more dangerous to more people than others? Can you compare those?
Well, I would say that COVID is still more dangerous, SARS-CoV-2. We certainly have many more people in the hospital currently because of COVID-19 or who are testing positive for COVID-19 than we do for influenza, and fortunately very few with RSV. And for people who don't have immunity, COVID is still a much more serious infection than influenza is.
All right, Dr. Kritzkis, as you well know, we made it through the holiday season without a big surge of COVID cases, which we had seen both of the last 2 years. I think that was kind of the last hurdle out there for us laymen as we were trying to return to this normal or this new normal world. So we're past that. So when do you think we can start treating this virus, COVID, like others? Maybe eliminate those mandatory quarantines that are out there?
Yeah, that's the billion-dollar question. I know you're so over COVID-19, but I think that for individuals, going about their everyday lives is, for most people, pretty reasonable. The challenge is still what to do if somebody does come down with COVID-19 and to what extent do we have to protect other people from contact. And I think that depends a lot on the environment you're in, where you're working and who you're in contact with. And of course, we continue to look to the CDC for guidance on that point.
Okay, Dr. Daniel Kritzkis, as always, thanks for joining us.
Thank you.
You're very welcome.
And to our viewers, if you have questions you'd like our experts to answer, email them to ask@wcvb.com.